Hi everybody, we're on our final topic for Unit 3, Topic 3.5, Client Health Teaching. For this topic, I'm going to cover the learning outcomes. I'm going to summarize the importance of health teaching, describe the health professional's role in patient education, outline the domains of learning and types of learners, which we pretty much covered in the first forum for Unit 1, and describe the principles of teaching. There are two other learning outcomes for this topic as well. However, all the information that I think you need is on the PowerPoint slide. So I'm going to let you read through that instead of going over it point by point. If I had something more to add, I would probably go through them, but I really don't. So I'm just going to leave them the way they are. As a healthcare practitioner, it doesn't matter what level of healthcare practitioner you are, what level the clients meet you. It's our mandate. We are legally, ethically mandated to ensure our clients have the appropriate information to make the right decision, or to make an informed decision, not necessarily what we feel is the right decision. It's up to them. So we need to give teaching that is specific to their needs. We need to give them enough information that they have sufficient information to make an informed decision and take responsibility for their own care. We're not always going to agree with the decision they make. However, as long as you've provided them the information that you feel is what they need, you've done your job. And just make sure that you chart that. It needs to be understandable. It needs to accommodate various learner styles. So if you're going to deal with somebody who's elderly, you're not just going to hand them a pamphlet with tiny writing on it. You're actually going to go through it. Information is power. The more information our clients have, the better prepared they are to make an informed decision. So the two words, information and communication, are often used interchangeably, but they're quite different. Information is giving out. So that's the material that we give to our clients. Communication is how we do that. So both very important terms, but we need to be able to communicate appropriately in order for that information to make it to where we want it to get to. So what is our role in client education in doing what we're doing? Well, three main things we want to do by giving out information is to change health behaviors. Currently, if it's not, they're a smoker, you want them to not smoke, you're hoping to change that health behavior. For you, it's going to be more life-threatening at the point. You want to improve their health status, definitely. Improve client compliance. I've witnessed incidences where EMTs have come to a house, and I've been in the house, been called to the house by a neighbor, and the patient was exhibiting, or she suffered, a hypoglycemic event. And it was really frustrating because the EMTs gave her all the information she needed. And all she's saying is, I'm drinking orange juice. And she refused to go. But they charted, they had given the information, provided her the best information they could, and she refused their care. So you're going to come across that. But as long as you chart what you've done, and in your mind you've given the enough information that she could make an appropriate, informed decision, then you've done your job. Domains of learning. We already pretty much covered this in the Unit 1 forum. Cognitive, affective, and psychomotor. So we do things with the head. It's our thinking processes. Knowledge and understanding. So that's a first level usually of learning. Affective, the heart. Usually concerned with emotional attitudes related to acceptance, compliance, value, and taking personal responsibility. And many of you, like myself, like the psychomotor learning. So we like to learn it cognitively, but then to actually cement it in our brain, we have to do it. You have to get your hands on, It usually refers to skill-based learning. So we need to consider the different learning styles. So the visual, auditory, and kinetic. And many of you express that you are visual and kinetic learners during your Unit 1 forums. There are 12 principles of effective teaching. I'm going to go through all 12. They're important. They apply to anybody who's doing any sort of teaching to anyone. So number 1, teachers' knowledge of the subject matter is essential to the implementation of important teaching tasks. So teachers who know their subject matter thoroughly typically are more effective and efficient in organizing the subject matter, connecting the subject with the student's previous knowledge, finding useful analogies and examples, and establishing appropriate emphasis. So they typically know what they want to teach. Number 2, active involvement of the learner enhances learning. And you've already expressed that in Unit 1 forum. When you're more involved in your learning, when you're doing the hands-on and you're either having class discussions or case studies you're all working on, you actually learn better. You learn better in a community setting of learning. Teaching without an accompanying experience is like filling a lamp with water. Something has been poured in, but the result is not illuminating. And how true is that? Number 3, interaction between teachers and students is the most important factor in student motivation and involvement. It's been shown that interaction between students and faculty, particularly informal interaction, is one of the most important factors in student motivation or learning. The opportunity to know a few faculty well often enhances students' intellectual commitment and provides valuable role modeling. And I've heard that a couple times in the Form 1 posts, that you've connected with a couple of your instructors at Lac La Biche, and you actually kind of look up to them and value their insight. Students benefit from taking responsibility for their own learning. How true. If you're motivated, you're going to learn more. There are many roads to learning, and you're seeing them. Students learn in different ways and vary in their abilities to perform certain tasks. Many of you described instances where you would go to YouTube to learn something. There are many ways to get to the end. Expect more and you will achieve more. Simply stated, if an educator conveys to students that he or she believes in their ability to succeed, learning is enhanced. It's like, given an attaboy. Learning is enhanced by an atmosphere of cooperation. For sure. If learning is enhanced when it's perceived as a collaborative and cooperative effort between students. If you're all in it together, the opportunity to share ideas without threat of ridicule and the freedom to respond to the ideas of others increases complexity of thinking. And that's what the forum posts basically are trying to do. Materials must be meaningful. It must apply to what you've already learned, kind of scaffolding on to what previous learning, and you'll learn more. Both teaching and learning are enhanced by descriptive feedback. Without feedback, neither learner nor teacher can improve because they will not know what they need to know or what extent they are fulfilling their goals. So feedback goes both ways. And it's kind of like when I just asked for your feedback, whether or not the videos were helping, if the format was helping, was I reading too much? So that's kind of looking for feedback from you. And based on your feedback, I will change the way I deliver my material, or I'll leave it the same. Critical feedback is only useful if the learner has alternatives to pursue. So there's no use giving teachers or students feedback about their performances unless they can do something about it. That is, unless they have some alternative course of action or behavior. And there's two more because we said 12. Time plus energy equals learning. Learning takes energy and you have to put effort into it. So unless you put the appropriate amount of time and energy into learning something, you really have wasted your time. Experience usually improves teaching. And so as you become more proficient in your practice, you'll become a more confident and proficient teacher as well. You'll be more confident in your abilities. So these are teaching strategies, and I'm just going to go through this one because I think it's important. Schedule teaching time into your day. You're not going to choose a time, and you probably at your level of teaching that you'll be doing. If your patient is in pain, if she's anxious, if she's crying, or they're distracted. Doesn't matter what kind of information you're going to give them at that point. They're probably not going to take it in. So make sure your timing of your teaching is appropriate. So keep it short. So that's all I'm going to say on this. Sorry, my throat's really dry today. That's all I'm going to say on the time in the teaching, because that's really what relates to you, is that just take into consideration, I know the information is important that you're giving to your clients, but take into consideration, are they actually ready to listen to that information? The rest of the slides are exactly as you already have, and I'm not going to go through these as you have them in your PowerPoint handout. So pay attention to the strategies employed for the different situations that require special health teaching strategies. We're going to talk a little bit more about those in Unit 5, but it's just to get you started thinking about them already. So we'll be on to Unit 4 next, and it's all about reflective practice, which is another really, really important topic.